So there's something on the bookshelf behind me that could kill you. Honestly, I've seen people die from using this, young people and old. This is really, really important information that every doctor should be giving to anybody that takes painkillers regularly. Let me just show you what this is. So this is ibuprofen, or Advil, I think you call this in the US. Now, I'm currently taking this for a knee injury, but I know from direct experience from the patients that I've seen in the emergency department that if I take this long term, that it could knock years off my life. And that's not supposed to be dramatic. That's the truth. Over the years, I've worked on 4 patients in cardiac arrest from stomach bleeding. All of them were under the age of 60 and none of them survived. I've treated patients with end-stage kidney failure caused by it. I've seen patients in their 40s who have taken it long term who were on the verge of kidney failure. Honestly, I'm not making any of this up. This video isn't supposed to be scary. I'm simply giving you the facts and my own experience here. Almost every patient that I talk to about this says the same thing, but it's just ibuprofen. Now, just pause for a second and think about that. Ibuprofen sits on the supermarket shelves next to paracetamol and antacids. You don't need a prescription. You don't need to speak to a doctor or a pharmacist to get it. Millions of people take it every week without a second thought. And yet this drug affects your heart, your kidneys, your gut lining, your blood pressure, and even the way your body ages. Now, I can guarantee that a huge proportion of you watching this video that take this medication probably haven't read the safety label properly. And to be honest, why would you? Surely if you can buy it so easily, then it's got to be safe, right? Well, the reason I'm making this video is because in the A&E, I see the downstream consequences of something that most people assume is completely safe. And the truth is, ibuprofen isn't harmless. Now, don't get me wrong, it absolutely can be used very safely and very effectively if you follow some general rules. This isn't a super dangerous medication that everyone should stop using. It's the way people use it that's the dangerous part. So today I'm going to explain exactly how this works, why we use it in the first place, and what the research actually tells us about long-term use. I'm Dr. Alex. I'm an emergency medicine doctor from the UK, teaching you how to live longer and live more healthily. And in return, all I ask is that by the end of this video, if you've learned something valuable, then please consider subscribing to the channel because it really does help these videos reach more people who might benefit from them. So, most people seem to know that ibuprofen stops pain, but almost nobody knows how. And that's a problem because the mechanism itself explains most of the risks that follow. Ibuprofen belongs to a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs. We use them for pain, inflammation, and fever as well. Now, the way they work is by blocking 2 enzymes in your body called COX-1 and COX-2, COX spelt COX. Now, these enzymes are responsible for producing chemical messengers called prostaglandins. And here's where most explanations oversimplify things. The prostaglandins get labelled as bad chemicals that cause pain and inflammation. And that's partly true. Some prostaglandins do sensitize nerve endings and amplify inflammatory signals, which is why blocking them reduces pain. That's the reason ibuprofen works so well. But prostaglandins aren't just troublemakers. They also protect the stomach lining from acid damage. They maintain blood flow to the kidneys. They help regulate blood clotting, and they support normal vascular function throughout the body. So when you take ibuprofen and you block prostaglandin production, you're not just switching off the pain signal, you're also switching off the protective effects that those prostaglandins provide to your stomach, your kidneys, and your cardiovascular system. That dual function creates a trade-off. Ibuprofen reduces pain because it suppresses prostaglandins, but in doing so, it also removes the defenses that they provide elsewhere. And that's where the risk comes from. Look, I don't want you to walk away from this video and think that ibuprofen is some dangerous poison that should never be touched, because that would be dishonest. For short-term pain relief, it works brilliantly. I use it, to be honest, probably more often than I should. It reduces inflammation after an injury, it helps to manage post-surgical pain, and it can be a lifesaver after dental procedures. In many cases, it's safer than prescribing opioids, which carry their own significant risks. When used appropriately, for a few days at a time, and that's important, ibuprofen is a useful tool. The issue isn't with occasional use, the issue is with long-term use. Taking ibuprofen every day for weeks or months or years, which some people do, honestly, that changes the risk profile completely. And that's what most people don't seem to realise. They think because it's available without a prescription, then it must be safe to take whenever they want, for as long as they want. And that assumption is really dangerous. So let's go into the risks a bit. So you've probably heard that ibuprofen can upset your stomach a bit, but what actually happens inside your body goes far beyond just a bit of indigestion. As I mentioned earlier, prostaglandins protect your stomach from acid. When you block prostaglandin production with ibuprofen, that protective layer weakens. Stomach acid, which is incredibly corrosive, starts damaging the lining, and over time, this can lead to erosions and ulcers, and eventually bleeding. NSAIDs, non-steroidal anti-inflammatory drugs, account for between 30 and 50% of all upper gastrointestinal bleeds. That's a staggering proportion. The risk of serious GI bleeds increases fourfold with chronic NSAID use, and that risk climbs even higher if you're over the age of 65, if you're on steroids, if you're taking anticoagulants like warfarin or apixaban, or if you're also taking aspirin for your heart. Large meta-analyses, these big research studies, they've shown that even over-the-counter doses, when used regularly, significantly increase the risk of bleeding. Now, these bleeds aren't minor. I've seen people vomit litres of blood within a few minutes. I've seen blood pressure drop so low that we've had to transfuse multiple units just to stabilise them. Some of these bleeds are catastrophic, like I mentioned earlier. And the thing that gets me every time is that the patient had no idea that ibuprofen could do this. They thought it was just a safe painkiller. Let's move on to your kidneys for a second. So these two small organs in your bag, they filter around 200 litres of blood every single day. And they need a steady flow to do that job properly. Your kidneys rely heavily on prostaglandins to maintain adequate blood flow, especially when you're dehydrated, or when you're unwell, or when you're older, or when you're taking certain medications like ACE inhibitors or diuretics. When you block prostaglandins with ibuprofen, you reduce blood flow to the kidneys. And in the short term, this might not cause any noticeable problems. But if you're already dehydrated, or if you're taking other medications that I mentioned earlier, then this reduction in blood flow can tip you over the edge into acute kidney injury. Your kidneys stop filtering waste properly, fluid starts building up in your body, and your electrolytes become dangerously imbalanced. Now, NSAIDs are one of the leading causes of drug-induced acute kidney injury. And there's something called the triple whammy that every doctor learns to watch out for. If you combine an NSAID with an ACE inhibitor like ramipril or enalapril and a diuretic like furosemide maybe, then you dramatically increase the risk of kidney damage. Each of those drugs affects kidney blood flow or fluid balance, and together they create the perfect storm. And here's another thing that catches people off guard. Taking painkillers can actually raise your blood pressure. Ibuprofen causes your body to retain sodium, which increases your fluid volume. It also increases vascular resistance, which means that your blood vessels constrict slightly. Now, both of these effects raise your blood pressure. There's a study called the Precision Trial, which compared cardiovascular risks between different NSAIDs, and it showed that ibuprofen increased blood pressure more than naproxen, which we typically consider a safer version of ibuprofen sometimes. And there are other studies out there that have shown that taking ibuprofen increases your risk of heart attacks and strokes and even heart failure. Even a modest increase in blood pressure, around 5 millimeters of mercury, can increase your stroke risk by roughly 10%. It's huge, honestly. If you already have high blood pressure, then this really matters. If you're taking medication to control your blood pressure, and then you're also taking ibuprofen regularly, then you're working against yourself. Your antihypertensive medication is trying to lower your pressure, and the ibuprofen is pushing it back up. I've seen patients whose blood pressure control suddenly deteriorates, and when we go through their medication, we suddenly find that they've been taking ibuprofen for weeks or months, and they've never mentioned it to their doctor. So here's something really interesting from a longevity perspective. So aging research keeps pointing to the same underlying driver, which is chronic inflammation. But suppressing inflammation with a drug doesn't fix the underlying problem. Ibuprofen masks pain and reduces inflammatory markers temporarily, but it doesn't address the root cause. And there's emerging evidence that chronic NSAID use might actually interfere with some of the body's adaptive processes. Some research suggests that NSAIDs might blunt muscle adaptation in older adults. It might potentially interfere with the hypertrophy response to resistance training, which is super important. There's also data suggesting that NSAIDs can disrupt your gut microbiome diversity, which has massive downstream effects on your metabolic health and your immune function. Now, there are observational studies out there that have shown that chronic NSAID use is associated with increased mortality in certain high-risk populations, particularly those with cardiovascular disease or chronic kidney disease. And I need to be really careful here. This doesn't mean that taking a single ibuprofen is going to harm you. I don't want to cause unnecessary worry in this video. But what it does mean is that chronic, regular use over months and years isn't neutral. The risks accumulate. And for something that you can buy without a prescription, this is really important to understand. The stomach bleeding that I talked about earlier gets most of the attention, but there's another layer of gut damage happening that almost nobody really talks about. Ibuprofen also affects the small intestine in ways that often go unnoticed. They increase intestinal permeability, which means that the tight junctions between the cells lining your gut become more leaky. And what this allows is larger molecules and bacteria to cross into the bloodstream, triggering immune responses and inflammation elsewhere in the body. Capsule endoscopy studies, where patients swallow a tiny camera in a capsule that travels through the digestive tract, have revealed something really striking here. Up to 60 or 70% of people taking NSAIDs chronically have small bowel ulceration, and most of these people have no symptoms at all. They don't know it's happening, but the damage is there, silently disrupting the integrity of the gut lining and potentially affecting the microbiome composition. This is one of those findings that doesn't really make the headlines, but it should. Your gut health influences everything from your immune system to your mood to your metabolic function. And something else that matters more than most people realize with ibuprofen is age. If you're over the age of 60, then you're at a higher baseline risk for all of these complications. If you have chronic kidney disease or even mild impairment, which most people over the age of 60 do, then ibuprofen can push you into really dangerous territory. If you have high blood pressure or any form of cardiovascular disease, then chronic ibuprofen use can worsen those conditions. If you're on an ACE inhibitor like ramipril or an ARB or a diuretic, then the combination of those creates additional risk. If you're taking anticoagulants like warfarin or rivaroxaban, then the bleeding risk multiplies. You should, to be honest, never take ibuprofen if you're on a potent blood thinner like that. If you have a history of stomach ulcers, then you're already really vulnerable. And here's one that surprises a lot of people, which is endurance athletes. Runners who take ibuprofen before a race thinking they will prevent pain are actually putting themselves at big risk. During prolonged exercise, you're already slightly dehydrated, your kidneys are under massive stress, and your gut lining is more permeable. Adding an NSAID into that mix like ibuprofen increases the risk of kidney injury and gastrointestinal damage. Studies on marathon runners have shown significantly higher rates of kidney injury in those who took ibuprofen before the race. So let me just end with this. Ibuprofen isn't evil. It's a useful medication when used appropriately, but it's not harmless. There's a huge difference between taking ibuprofen for a few days after a dental extraction or taking it for a knee injury like me, and then taking it daily for months because your back hurts or your joints ache. Occasional short-term use is usually fine. Usually. Daily use for weeks or months means that the risks accumulate over time. If you do need to take ibuprofen regularly for a genuine inflammatory condition, then there are ways to reduce some of the risk. For example, most doctors would prescribe a stomach protector called a proton pump inhibitor, or PPI, like lansoprazole or omeprazole, to reduce the risk of ulcers and bleeding in your stomach. But that doesn't eliminate the other risks, like kidney strain or blood pressure elevation. The most important thing is this. If you feel that you need painkillers beyond just a few days, then that's the point where a conversation with your doctor should be happening. The patients I see in the emergency department don't end up there because of 1 or 2 tablets. They end up there because of months or years of cumulative small decisions repeated over and over, until something finally breaks. A stomach bleed, kidney failure, a stroke. And in that moment, when I'm explaining what happened, I hear the same thing. But I thought it was safe. It's just ibuprofen. And that's why I made this video, because it's not just ibuprofen. Every medication has risks. Risks that are absolutely worth understanding.